Introduction. Pseudobulbar palsy, PSP, is a neurodegenerative disorder characterized by the accumulation of abnormal tau protein aggregates in the brain. This leads to progressive brain atrophy and a range of motor, cognitive, and behavioral abnormalities. Understanding the molecular mechanisms underlying tau isoforms and their role in PSP pathology is crucial for the development of effective therapies. Additionally, investigating the role of neuroinflammation, executive dysfunction, altered connectivity patterns, biomarkers, genetic factors, tau propagation, cognitive and behavioral subtypes, oculomotor impairment, deep brain stimulation, and neuropsychiatric manifestations in PSP can provide valuable insights into disease progression and aid in the development of novel treatment strategies. In this script, we will explore each of these topics in detail to enhance our understanding of PSP and its complexities. PSP is primarily characterized by the accumulation of hyperphosphorylated tau protein aggregates in the neurons of affected brain regions. Tau is a microtubule-associated protein that plays a crucial role in maintaining the structural integrity of neuronal axons. However, abnormal phosphorylation of tau leads to its dissociation from microtubules, resulting in the formation of insoluble tau aggregates known as neurofibrillary tangles. In PSP, an imbalance between tau isoforms, namely 3R and 4R tau, has been observed. The relative ratio of these isoforms may influence the progression and severity of PSP pathology. Understanding the molecular mechanisms underlying the formation of tau isoforms and their pathological implications can offer potential targets for therapeutic intervention in PSP. Neuroinflammation, characterized by the activation of microglia and astrocytes, has been recognized as a key player in the pathogenesis of various neurodegenerative disorders, including PSP. The pro-inflammatory cytokines released by activated glial cells contribute to neuronal cell death and the propagation of tau pathology. Modulating neuroinflammation represents a potential therapeutic strategy for PSP. Understanding the intricate interactions between glial cells, pro-inflammatory mediators, and tau pathology can aid in the identification of novel therapeutic targets for the management of PSP. Executive dysfunction, involving impairments in higher-order cognitive processes such as planning, decision-making, and attentional control, is a common feature of PSP. These deficits can significantly impact the quality of life and functional independence of individuals with PSP. Understanding the underlying neuroanatomical substrates and molecular mechanisms associated with executive dysfunction in PSP can help develop targeted interventions and management strategies to improve the cognitive functioning of affected individuals. Advancements in neuroimaging techniques have allowed for the examination of structural and functional connectivity patterns in individuals with PSP. Altered connectivity within the basal ganglia, frontal cortical regions, and superior cerebellar peduncle has been observed in PSP. These connectivity disruptions can provide insights into disease progression and the neuroanatomical substrates underlying motor, cognitive, and behavioral impairments. Elucidating the specific patterns of connectivity alterations in PSP can contribute to a better understanding of the disease and enable the development of targeted treatment approaches. Early diagnosis of PSP remains challenging due to the absence of reliable diagnostic biomarkers. However, emerging research has identified potential biomarkers, such as cerebrospinal fluid, CSF, levels of phosphorylated tau, neurofilament light chain, and other neuroinflammatory markers that show promise in distinguishing PSP from other neurodegenerative disorders. Additionally, advances in neuroimaging techniques, such as positron emission tomography, PET, imaging using tau-selective ligands, have facilitated the visualization and quantification of tau pathology in vivo. These biomarkers hold great potential for enabling early detection, monitoring disease progression, and assessing the efficacy of disease-modifying interventions in PSP. Multimodal imaging techniques, combining structural and functional imaging modalities, have provided valuable insights into the neurobiology of PSP. Techniques such as magnetic resonance imaging, MRI, diffusion tensor imaging, DTI, functional MRI, fMRI, and PET imaging allow for the investigation of anatomical, microstructural, functional, and molecular alterations associated with PSP. These imaging approaches, when combined with clinical and neuropsychological assessments, can contribute to a comprehensive understanding of PSP pathology and aid in the development of diagnostic and prognostic tools. Although most cases of PSP are sporadic, a growing body of evidence suggests a genetic contribution to disease development. Genetic variations in genes such as MAPT, which codes for tau protein, have been identified as risk factors for PSP. Understanding the genetic factors that modify the risk and expression of PSP can shed light on the underlying pathogenic mechanisms and facilitate personalized approaches to disease prevention, diagnosis, and treatment. Propagation of tau pathology is a key feature of PSP and other tauopathies. It is believed that abnormal tau spreads from one neuron to another, contributing to the progressive degeneration and clinical manifestations observed in these disorders. Elucidating the mechanisms of tau propagation and understanding the correlation between tau pathologies in different brain regions can provide insights into disease progression and facilitate the development of targeted therapeutic interventions to halt or slow down the spread of tau aggregates. PSP is a heterogeneous disorder with substantial variability in the cognitive and behavioral manifestations observed across individuals. Identifying distinct subtypes based on cognitive and behavioral profiles can facilitate a more personalized approach to diagnosis, prognosis, treatment selection, and monitoring of disease progression. Understanding the cognitive and behavioral subtypes of PSP and their associated clinical implications can lead to improved management strategies tailored to the specific needs of affected individuals. Oculomotor impairment is a prominent clinical feature of PSP, characterized by vertical supranuclear gaze palsy, impairments in smooth pursuit, saccade abnormalities, and disturbances in optokinetic nystagmus. Functional neuroimaging techniques, such as fMRI and PET, have enabled the investigation of the neural circuits and areas involved in oculomotor control and their dysfunction in PSP. These findings can enhance our understanding of the underlying mechanisms of oculomotor impairment in PSP and contribute to the development of targeted interventions for managing this debilitating symptom. Deep brain stimulation, DBS, has emerged as a potential treatment modality for PSP-related motor symptoms, such as Parkinsonism and dystonia. By delivering controlled electrical stimulation to specific targets within the brain, DBS modulates aberrant neural activity and restores normal functioning. Preliminary studies have shown promising results in ameliorating motor symptoms and improving the quality of life in individuals with PSP. However, further research is needed to optimize target selection, stimulation parameters, and long-term outcomes of DBS in PSP. In addition to motor and cognitive impairments, PSP is associated with a range of neuropsychiatric manifestations, including depression, apathy, anxiety, psychosis, and disinhibition. These symptoms significantly impact the quality of life of individuals with PSP and their caregivers. Developing effective strategies for managing neuropsychiatric symptoms is crucial for improving the overall well-being and care of affected individuals. Understanding the underlying neurobiological correlates and utilizing a multimodal approach combining pharmacological, psychological, and behavioral interventions can aid in symptom management and enhance the quality of life in individuals with PSP. In conclusion, PSP is a complex neurodegenerative disorder with diverse clinical manifestations and underlying pathological mechanisms. Exploring the molecular mechanisms of tau isoforms, neuroinflammation, altered connectivity patterns, biomarkers, genetic factors, tau propagation, cognitive and behavioral subtypes, oculomotor impairment, deep brain stimulation, and neuropsychiatric manifestations can provide valuable insights into disease progression and pave the way for the development of targeted therapies. With ongoing research and advancements in diagnostic tools and treatment strategies, we aim to improve the lives of individuals affected by PSP and work towards effective disease modification and management.